Good morning. Welcome to Spotlight on Light 100.5 WRCH. I'm Chuck Taylor, joined today by Sherry Poirier, Executive Director of the Epilepsy Foundation of Connecticut. Did I say your last name correctly,
You did.
Sherry?
Thank you.
Joining her is Monica Anzalone, Program Services Coordinator, and Elizabeth Stiblow, Fundraising Development for the Epilepsy Foundation. Sherry, let's start with you. Now, can you explain to us what epilepsy is?
Yeah. Epilepsy, it's a neurological disease where surges of electrical activity in the brain cause people to have recurrent seizures. And it's a medical condition. It's a chronic disease like diabetes or asthma or medical conditions, and is the fourth most common neurological disorder.
Really?
Yeah. Yep.
Now, how many people are affected by epilepsy?
There are over 3.4 million people living with epilepsy in the United States alone. There are international studies also, and it's roughly 3 million adults and 470,000 children that are diagnosed with epilepsy in the United States. About 150,000 new cases are diagnosed every year, and it's affecting people of all genders, age, and race.
Wow, okay. Now, Sherry, how has epilepsy touched your life?
Epilepsy has touched my life because I live with it. I've been diagnosed with it. I was diagnosed back in school, in high school, and it was very difficult to learn what that was about, to live with this disease. So, yeah. And like most examples of overcoming adversity, I had to learn a different way of living. Epilepsy caused me and my family to have a complete change of my outlook on life and their own outlook on life. I was diagnosed at age 15, so epilepsy made for a tough adolescent time, as adolescence is difficult to begin with. So,
Sure.
Yeah, there were a lot of social and emotional effects. It impacted my ability to drive, which was a huge teenage and young adult factor. I had to rely on others to get me to school, work, appointments, and activities, and had to walk whenever I could not get a ride. So I underwent a successful brain surgery after many years of living this and trying to get different medications to work that did not work. Ended up having many large epilepsy seizures, which ended up causing convulsions, and I ended up with concussions many times, just different situations that I realized that medication wasn't going to work. So at age 29, I finally made the decision to have brain surgery, which was in 1999. It was a great success. I still have minor seizures, and one of those things is my nerves go. I get very nervous and have anxiety attacks. But other than that, I'm doing great. I finally was able to get my driver's license 2 years after my surgery, and it changed my life and everyone that knows me.
Wow.
So it's been a life. It's been crazy.
That's actually a great story. It's a fantastic outcome.
Yeah, it's not easy for me to tell my story, but the reason I feel that I should and want to do this is because I know there are so many others here in Connecticut and elsewhere that live with epilepsy and live through the drama that it entails. I was lucky. I'm very lucky to be able to have family, friends, transportation, easy access to work if I needed it. I had close net family.
Right.
But there are many others that are diagnosed with epilepsy that do not have this. And that's what our foundation is about. It's trying to not only build awareness of what epilepsy is and what seizures entail, but to offer services and programs and, mental health, social needs, meet their social needs whenever we can with our different programs and services.
And so what brought you to the Epilepsy Foundation of Connecticut?
Honestly, I feel it was either luck or, it was by chance that I was working. Well, I was working prior to this at the Health Education Center that's down in New London, Connecticut.
Okay.
As their development coordinator. So I worked on grants and grant funding. So one thing that I did was I found a grant through an AHEC corporation, and I wanted to, it was about doing different community services and being able to build awareness of epilepsy and epilepsy resources and the Epilepsy Foundation of Connecticut. So what I did is I contacted them to see if they'd be willing to partner on the grant. Mm-hmm. And at that time, they were in between their executive directors, so I connected with the staff there and also the interim president or executive director, and they wanted to partner with us in being able to do this. And it was like I learned so much about the foundation and what it is and what it can do. And I said, all right, I think I'm going to apply. And I did. And just to make a note, it was Monica that I was partnered with when that I connected with the most when it came to that grant opportunity that brought me from the Health Education Center to where I am now.
Let's bring Monica in. Monica Anzalone, the Programs Services Coordinator for the Epilepsy Foundation of Connecticut. What services can the Epilepsy Foundation provide for someone living with epilepsy?
Yes. So I can break it down into a few categories. So we really focus on education, advocacy, and support. In thinking of education, really there's a vast variety. It's very important, despite how common epilepsy is, as Sherry pointed out. This is not a condition that most people know about. So what we can do is we offer a variety of education programs specifically on seizure recognition and first aid to try and help bridge that gap in understanding about epilepsy while ensuring the safety of people with epilepsy. So audiences for these trainings can include, but are not limited to, school nurses, school personnel, first responders, law enforcement, and the list goes on. So particularly, though, for families and individuals managing epilepsy, we can offer educational webinars and other online educational resources. And I think most importantly, we can connect with people and families on an individual basis to even just help answer questions and provide resources as needed. As far as advocacy goes, it's difficult. As we just heard from Sherry, living the life of a person diagnosed with epilepsy can be challenging. The severity really runs a pretty broad spectrum for people, but we really try at the foundation to help people navigate their life as a person with epilepsy and understanding, if they are facing challenges in the community specific to discrimination, we can be advocates for them. And I like to say that we sort of empower people with information about their rights. Example, like in the workplace, in the workforce, if they're facing challenges due to their condition, we can kind of step in and help in that way. We can also help support legislation as it affects people with epilepsy, which we have done recently and even in the past as well. And then lastly, I'll close with the support, which is really encompasses everything we do, but we can provide financial support for families that require medical, different medical procedures or devices that might help them in their epilepsy that insurance does not cover. This fund was created a few years ago, and that has been a great asset to our services for people. And then also socially connecting people one with another in way of support groups. All of our support groups are virtual. But we also do try and organize like recreational and social activities in the community, again, to help people connect. Epilepsy can be a very isolating condition. And so really just connecting people and having them share their stories and is really an important thing. So.
And do you have a website where people can go if they want to find out more information?
Yes. So epilepsyct.com, if you go under the section titled Programs and Services or just Programs, it'll all be mapped out for you there.
All right. Very good. Thank you.
You're welcome.
Sherry, if you would, why is the foundation important to the residents of Connecticut?
Our foundation is a statewide resource with caring staff, volunteers, and community health workers that are out there willing to listen and connect people living with epilepsy to valuable services, programs, and with others living with epilepsy, which is all that Monica shared with you. We're also available to caregivers, family members, employers, teachers, and others interested in supporting our foundation, our different programs, and moving forward and being able to bring this awareness of our foundation to areas of the state that is not yet aware of us, and also the what is available throughout the state to help them in living with this disease.
And why is collaboration so important to your foundation?
Well, as a nonprofit, we rely on other valuable community resources that can benefit those people with epilepsy, but are beyond our scope to provide. For example, we rely on agencies that provide mental health services, clinical connections to healthcare providers, which is part of our epilepsy resource rooms, epilepsy centers, disability agencies, etc. Also, we want to work with housing and transportation partners throughout the state because transportation is is an issue that we get calls about quite a bit. So being able to network with those that are available in the different regions of the state is what we need to do and what we are doing. So greatly appreciated to all organizations out there that are willing to support us and other people living with epilepsy so that they can live their best lives.
You're listening to Spotlight on Light 100.5 WRCH. Our guest this morning, Sherry Poirier, Executive Director of the Epilepsy Foundation of Connecticut, Monica Anzalone, Program Services Coordinator, and Elizabeth Stiblow, who is the Fundraising Development for the Epilepsy Foundation. Thank you for joining us as well, Elizabeth. Thank you all for coming in today.
Thanks so much for having us.
Absolutely. Now, coming up in May, the foundation has the Walk to End Epilepsy fundraising event. What is going on? Can you tell us a little bit more about that? Go ahead and elaborate and tell us how people can get involved.
Yeah. So we are so excited for the Walk to End Epilepsy event series. It's the largest fundraising and awareness event in Connecticut that benefits the local epilepsy community. So throughout May, we are going to have 6 different walks all over the state. We will have walks in Stamford and Orange on Saturday, May 4th. We'll walk in Tolland and Plainfield on Sunday, May 5th. And we'll walk in Farmington and New Milford on Saturday, May 11th. So for all the walks, check-in starts at 9 a.m. and the walk itself actually starts at 10. And they are so much fun. We have speakers share their personal stories and experiences with epilepsy. We serve a free lunch, and we have really awesome music and fun giveaways. It is really just a big celebration of the epilepsy community. So the walks are a really great place for people affected by epilepsy to connect with other people who share the same experiences and truly understand what it means to have a loved one who has epilepsy or to have epilepsy themselves. And they're also a really fantastic place for people who do not have a connection with epilepsy to come and learn about the condition. We really encourage people unaffected by epilepsy to attend and learn because the more people who are educated about epilepsy, the less stigma people with epilepsy face.
Sure.
Yeah, so anyone who wants to attend is more than welcome. And to register, you can visit our website, epilepsyct.com. You can register as an individual or you can start or join a team. It is 100% completely free to register, but if you decide to donate or raise funds, we really sincerely appreciate that. All the money that is raised supports our programs and services that Sherry and Monica talked about today. This is the largest fundraiser that we have, and all the donations we receive through this event have such a huge and direct impact on the epilepsy community. So please join us. The event is really fun, and the epilepsy community is so welcoming and so kind, and we would love for you to be there.
That sounds great. Now, what kind of things are the funds used for? If you could tell us about that, Elizabeth.
Yeah, so they're used to support all our different programs and services. So that includes mental health programs, that includes memory and cognition programs. A lot of people with epilepsy suffer with short-term memory loss, so these programs can help teach them real skills that they can use to deal with that. We also have a summer camp for kids with epilepsy that some of the funds that are raised here will go towards. And a lot of other programs that we have, our support groups, our webinars. And another thing we do is we have money that we raise at these walks that goes towards providing other free community events and education events for people living with epilepsy. So some of those are different educational events. So every other year we put on an event called CARE Day. The acronym CARE stands for Conference for Advocacy, Resources, and Education. And at that event, we bring local neurologists and other epilepsy experts in to talk about a wide variety of epilepsy topics, and then to participate in a question and answer session with the attendees. We also do events that are focused on specific groups. So last January, we had a Women in Wellness event. Our attendees there got to attend presentations about how epilepsy affects women specifically, and then they got to participate in a lot of fun spa activities like massages and manicures. And events like these are a really great place for people with epilepsy, again, to learn more about their condition and connect with people who understand what they're going through. Another thing, the funds that we raise at the walks go towards is our Advocacy Day that we hold every year at the Connecticut State Capitol. At that event, we advocate for legislation that will benefit the epilepsy community, and these Advocacy Day events can be extremely effective. In fact, in 2023, we were able to get legislation passed that required public schools to provide seizure recognition and first aid training to their staff. So that was a huge win, yes. So all these events are really wonderful, and they have a real impact.
And how can people find out more if they want to get involved?
Yeah. So, again, you can go to our website, which is epilepsyect.com. And if you're interested in the events, there is an events page. So you can just click on that and find all the information about volunteering and attending and sponsoring these events.
Very good. Thank you, Elizabeth.
Yes.
Sherry, why don't you come in again? I want to thank you for sharing your story with us here this morning on Spotlight on Light 100.5. Anything else you'd like to add?
Well, you're welcome for sharing my story. And I know that there are many others who have much more powerful stories that it would be wonderful for us to be able to share with others. Living in Connecticut and throughout the nation, we have our affiliate collaboration with different epilepsy foundations throughout the United States, and also the Epilepsy Foundation of America, and all of our partners that are statewide and within the state of Connecticut. So it would be great to have others come in and tell their stories, or to come and volunteer with some of our fundraising events, or even perhaps join some of our groups that we have.
Very good. And you want to give the website again?
Yes, it is epilepsyect.com.
All right, Sherry Poirier, Executive Director of the Epilepsy Foundation of Connecticut, Monica Anzalone, Programs Services Coordinator, and Elizabeth Stiblow, Fundraising Development for the Epilepsy Foundation of Connecticut, joining us this morning on Spotlight here on Light 100.5 WRCH. Thank you all very much for coming in this morning.
Well, thank you.